Have you ever wondered about the use of CGMs, or perhaps you're not even familiar with using them and how to use them? Have you wondered about GLP-1s? Are they for you? Is that the most effective way on your weight loss journey? We are going to dive into all this and so much more with a guest. I'm so excited to have him on, and it's his second time on the show. I will make sure to link to the first episode because it's a good precursor to our discussion today, where we will go a little bit deeper. Today, I have with me Dr. Paul Kolodzik, MD. He is a double board certified in emergency and preventative health. He is a metabolic health physician with 30 years of experience. As a private practice metabolic MD, he has used continuous glucose monitors, CGMs, which I referred to at the beginning of the show, to help thousands of patients to lose weight and prevent and reverse disease. In his first book, highly recommend this book, The Continuous Glucose Monitoring Revolution, he presents a comprehensive program for metabolic health success using CGMs. Dr. Kolodzik, welcome to the show.
It's great to be back with you, Carol. Thanks for having me again.
You should see the notes in front of me. I have so many notes, so many things I want to ask, but I want to start so basic. First of all, why is it important to really halt the progression of pre-diabetes? So let's say somebody is on that edge, they're pre-diabetic, and is there a point where it's not reversible? I kind of want to make that distinction here.
Yeah, so that's actually a very good question, and that specific question is still under some debate in the medical community. I can tell you where I come down on it. So the issue is the issue of insulin resistance, which we can maybe get into a discussion of the details of it, but people then progress to the point where they're pre-diabetic. Now, the party line generally in medicine is if you're pre-diabetic, you can reverse prediabetes completely and never go on to become diabetic. But once you get into a diabetic range, then you likely have some permanent insulin resistance that is going to be hard to completely reverse. Now, that being said, I've had plenty of diabetics that we get off medication, either oral medication or even insulin. So the term I like to use for that is we're putting diabetes in remission. I hate to say that we've cured a person's diabetes, because I think if they're not very strict about their diet, and potentially even if they are, because insulin resistance can progress as you get older, there is that risk. But people can do themselves a whole lot of good, whether it's completely reversing prediabetes so you never go on to become diabetic, or you manage your diabetes so that you don't require medications. You can do this with diet and lifestyle changes, or you can minimize your use of medications.
Oh, it's a good explanation, because I have RA, an autoimmune disease, and I feel like there's this tipping point. There was with me by the time I realized I had it, it had progressed substantially. So I've never been able to fully reverse it, but with lifestyle, I'm able to keep symptoms down. I'm able to put that in remission, so to speak. So I like that you made that distinction. Now, where do the continuous glucose monitors, the CGMs, come into play? What are they, in case somebody's just never used one or seen one?
Sure. So CGMs are those devices that you see on the back of the arms of diabetics, and they're placed there and put a little filament sensor under the skin, which picks up the blood glucose reading in that area. So you put a CGM on, and for 2 weeks you get 24/7 blood glucose readings that can just be enlightening to many, many people. So traditionally, these devices were used to dose insulin, make sure your blood sugar was not too high, make sure after you took some insulin that your blood sugar didn't go too low. But I've been using them now for 7 or 8 years in non-diabetics, pre-diabetics, people that are is for metabolic syndrome, people that are overweight, people that have diabetes in their family, because they can be an eye-opener for people in terms of what's going on with their blood sugar physiology. And the way my patients put it is, once I see that data, I can't unsee it. So if you're having spikes in your blood sugar, you're, developing insulin resistance, you're entering into that pre-diabetic area, even if you're diabetic pre-diabetic to actually see what is happening with your blood sugar, it can be life-changing for some people because they can have medical providers or whatever tell them for years, you got to watch this, you got to watch that. But when you see it yourself, it can be of tremendous benefit because people just have a tendency to self-correct. And then, of course, I'm a big advocate of low-carb diets in conjunction with the use of a CGM.
I want to dive into low carb because there's such a debate right now that I'm seeing on Instagram, in particular with menopausal women, postmenopausal women, where it's being suggested, okay, intermittent fasting, low carb, but then there's a new camp coming out saying that might not be the best thing. But what I've noticed just working with women and myself is the it depends kind of comes into play. Like, are you lifting heavy? Are you a really active person? Or are you just kind of getting started and have a lot of weight to lose? What do you find to be the best approach with menopausal women?
So I have a little bit of a skewed patient population. People come to me because they're middle-aged, overweight, at risk for those problems. So I do think if you have some insulin resistance, and we calculate exact levels of insulin resistance by doing fasting insulin levels, which I think are more important than cholesterol levels, but we assess where they are. And if you have insulin resistance, I do think low carb, high protein, making sure in the carbs you get, you're getting a fair amount of fiber is the way to go with some intermittent fasting. Now, once you have success, if, for example, you're strength training heavily, making sure you're getting adequate carbs to help, repair that muscle along with your protein, I think can be a reasonable thing to do. But, unfortunately, the issue I think we have primarily in the US right now related to obesity and diabetes is that we've had excessive carbs from processed food for now 50 years because we've been told by the government and the food pyramid and the food processors that's what we needed to do to keep our fat intake low. And of course, we have not done well in terms of those diseases in the US. And now it's getting a little bit of notoriety with the HHS stuff going on and Robert Kennedy and the Make America Healthy Again movement. And I personally think Making America Healthy Again is great, but I think 90% of it is just decreasing processed foods. And I understand red dye number 3 and emulsifiers can be a problem, but for the majority of people, the issue is more basic than that. And it's just like let's keep the carbs and the sugar low, stay away from the seed oils. And if you do that, I think you're 90% of the way there.
I agree so much. Even if somebody's not looking to lose weight, just from a health perspective, reducing the amount of processed foods or really overly processed foods in our diet is so important. Now, what is happening in menopause that makes women prone to being pre-diabetic or having glucose regulation problems? Because I've even seen it in women will come to me that I'm working with and they don't have weight to lose, but all of a sudden their blood sugar is high, like maybe they're 49, 50.
Yeah, when estrogen drops, then insulin resistance has an opening to take over. So it's just that the blood glucose physiology is affected by estrogen levels, and when estrogen levels drop, then there has a tendency to be increased amount of insulin released, and that is what that problem is.
And does this tie into the excess body fat, especially that body fat around the midsection that just all of a sudden comes out of nowhere, or it seems to come out of nowhere?
Yeah, so the process is if your blood sugar is a little bit high, and of course lower estrogen can lead to that as well because of the insulin resistance issue, then what happens is excess blood sugar goes to the liver and gets converted to fat. Some of it can stay in the liver and cause fatty liver disease, but the more of it gets deposited around the middle. And once that's deposited around the middle, it's a challenge to go ahead and reverse that process. But the only way really to do that effectively, if we are talking about medications, is really just to lower blood sugar, because then that process reverses itself. And instead of excess blood sugar being deposited as fat in the liver and around the middle, the organs start to look around when the blood sugar is a little bit lower, start to look around for another source of energy. And that source of energy is the fat that is around the middle. And so that's when that fat gets broken down and, can help, of course, with weight loss as part of that process. I would like to mention also that we hear, this increasingly about fatty liver disease. Fatty liver disease is a misnomer. People think, oh, fatty liver disease, I get fatty liver disease, I'm at risk for it because I eat fat. But really what happens is it's the conversion of blood glucose to fat in the liver that causes the majority of fatty liver disease. And as an aside, in my patients, when I get them to go low carb, for example, their triglycerides will drop because triglycerides are formed from the conversion of blood sugar to fat in the liver. And if you decrease the substrate, if you decrease the supply of blood glucose, you're going to reverse that process as well. So that's the benefit, I think, of a low carb diet, both in terms of blood sugar physiology and the fatty liver disease issue.
Those triglycerides. And we're kind of seeing this happening at a younger age, aren't we?
Oh,
People
yeah.
getting this younger and younger, the fatty liver disease.
Yeah, I have teenagers that I treat for that. Teenagers with significant insulin resistance, progressing toward type 2 diabetes, fatty liver disease. Now estimated that 1 in 5 adult Americans have fatty liver disease. So yeah, and it's just an outcome of, unfortunately what we were told to do for the first time in the 1970s with the food pyramid, which is, decrease your fat intake and increase your carbs. And of course, that opened a door to, processed food and high carbs, high sugar, fructose, corn syrup, and seed oils, which are the primary components of processed food. So, basically, when we talk about low carb, we're just talking about going back to the way that Americans ate for generations before we were told to eat higher carb amounts to avoid fat. So you look back at movies or photographs from, the 40s and 50s and early 60s, you don't see obese people. I mean, it's a rare obese person or overweight person you see. So really, I think being led in that direction by the government and the food processing industry has not done us any favors.
Agreed, agreed. Now, when you're talking low carb, and let's go back to the menopausal woman, for example, let's say she has weight to lose, she's becoming insulin resistant. How low is low? Because I get that question a lot, like how many grams and how many carbs do I eat and what kind?
Yeah, so the answer is a sustainable level, something that you can stick to. And I usually start my patients generally in the 35 to 50 grams per day range. I'll say as an aside, counting is important. Okay, knowing that you're keeping your carbs low because you're using an app to do that, at least periodically you're weighing and measuring your food is important. So 35 to 50 grams. And then, I use round numbers, get your protein, and you got expertise in this area, maybe likely more than I do because of your background. But, I like to see people get 100 grams of protein or more. So, I keep it simple. 50 grams or less of carbs, 100 grams or more of protein. I don't really worry about the fat, to tell you the truth. We get into good fats and bad fats at some point. If you avoid seed oils and fried fast food, you can avoid, and processed food, you can avoid the majority of harmful fats. But basically, just keep your carbs under 50, your protein greater than 100. Avoid seed oils and fried fast foods, and you're on your way.
Kind of varies. I'd say I'm a moderate range, but then I'm very, very normally. I'm recovering
Yeah.
from surgery right now
Yeah.
for my
I know.
shoulder,
Yeah.
but I'm normally so active. But
Yeah.
I'm never high carb, and I have found being 63 now that my sensitivity to it is increasing. In other words, I don't need as many carbs as I
Yeah.
used to need.
Yeah.
And that's, I kind of just stay in that moderate range.
Yeah. Yeah. And I have patients where, if they're getting 250 grams of carbs a day, maybe starting at 35 to 50 is a little bit tough, and we'll liberalize that a little bit. Though I have found that people are looking for progress, mainly in terms of weight loss. And sometimes it can be a painful process to kind of incrementally lower that number to 150 and then 100 and 75. Sometimes I feel it's better just to rip the Band-Aid off. And
Hmm.
people with the CGM on their arm adjust pretty well to that because they understand. They understand now what that pasta is done, or that occasional sugary drink. That they understand, and so they modify their diet really by themselves pretty well once they have a CGM.
Oh, they're so helpful. I wore one a few years back just so that I would understand the process, and it was eye-opening. Like, I remember going out to breakfast and having one slice of bread. That was all I had, just one slice of bread. I don't usually
Yeah.
eat bread, and that thing just shot up. Stress was another one. I remember I had a stressful event happening when I was wearing it, and I could not believe the spike in my blood sugar at that moment. So it was very eye-opening.
Yeah, I agree. I mean, for most people, I mean, I am an occasional person that doesn't have a lot of variability, but for most people, it's eye-opening. And now with CGMs being available over the counter, where you can get a CGM to wear on the back of your arm for 2 weeks, they're around $50. And it can be, again, life-changing for some people that don't think they have a problem. I've had all kinds of patients come to my practice over the years that are they come to me because they want to lose weight, but then when we assess their blood sugar physiology with a fasting insulin level in 2 weeks of a CGM, then it's eye-opening. And usually when I have a patient start a CGM, I have them not change their diet for a couple weeks. Let's see where you live. Let's have you understand what's been going on with your blood sugar physiology. And then after that, the CGMs often are used to guide that low carb diet going forward.
Love it. And I love that they're available now. That's so exciting and at such a really low price point when you think about your health and having all that information, because it used to be pretty expensive. I know I paid quite a bit for having a CGM, and then it came with a dietitian and an app and all that. And I paid quite a bit for that service. So this is really good news.
Right. I'll tell you, we'll talk about maybe at the end. I have a slim down service for, yeah, I'm licensed in 4 states, but for the other states, I wasn't able to serve those patients. But I've set up a mechanism where people can get a CGM at the lowest price available. And then I also have worked with CGM health coaches over the years who have expertise in this area, and they can provide some insight. And I'm not talking about long term, but maybe for a few weeks to understand what your CGM patterns are.
It's helpful. I know it helped me, even though I didn't have a goal of needing to reduce blood glucose levels, but it was still very helpful from a health perspective. Now, I want to shift gears over to the GLP-1s. This has continued to be a hot topic
Right.
and so many questions. First of all, what are they? And then how long should they be used? Like, what is the point where somebody's been on too long?
Yeah, so that's a relative question. I think the philosophy should be begin with the end in mind, and the end in mind should be eventually getting off this medication. Unless you're a person that says, I just want to be dependent upon a medication to manage my weight for the rest of my life, and I don't think there are many people that want to approach it that way. So I'm a big advocate of lower doses for limited periods of time. So these are medicines that you titrate up over a period of weeks and then you titrate back down. And I try and keep my patients on low doses. I use a philosophy that I call microdosing, which means let's go to just a lower or medium range of medicine while you're making all these lifestyle changes, so then we can titrate you down and off the medication. And I often do this in conjunction with a CGM. So the pattern often is let's get you CGM for a couple weeks. Let's do your fasting insulin level. Let's find out what's going on with your blood sugar physiology. Then let's start medicine if you want to go that direction. Again, this is a minority of my patients, but some of them, want to go that direction. And I don't want to lose them, quite honestly, to somebody else that's not going to emphasize the lifestyle changes. So then we begin with lower doses for limited periods of time, measured in months, not years, while we implement these lifestyle changes. And then we titrate them down and off. And then we integrate again at that point the CGMs, because as you're coming down, what people call the food noise may recur. And with the CGM, you can stay on track because as you monitor your blood sugar, it can guide your diet, very, very succinctly, and provide great insight as to the kind of foods you need to stay away from.
Now, what about the side effects of them? Are they common? Are they harsh? Are they more likely in some people and not other people?
Yeah, so this is why, again, lower doses for limited periods of time is a good approach. So people should go into this with their eyes open. There are some serious side effects that can occur. You've probably heard or read of them. Gastroparesis, pancreatitis. I have not seen those more serious side effects, and it's probably because, again, I emphasize the use of lower doses for a limited period of time. Nausea is pretty common, but again, with lower doses, you can keep that limited. So the side effects that I've seen primarily are nausea and then patients having some constipation. And if you go, I try and keep patients under 0.5 milligrams for semaglutide. If you go up to the standard high dose of 2.4 milligrams, you're going to be, more prone to have side effects, both not serious and potentially serious side effects. And again, it's going to take you longer to get off the medicine and to get off the medicine successfully without weight regain.
Now, are there different types? Is there some types that are better, more effective than others as
Yeah,
far as the GLP-1s?
that's a little bit open to debate. There are two primary GLP-1s that are on the market right now that are used for weight loss, that are approved for weight loss, and they're once weekly injections. There are some other medicines that are daily injections, but not many people are using them. My experience, and the brand names of these two medications are Wegovy, which is the Ozempic equivalent, and then Zepbound, which is the Mounjaro equivalent, and they're both effective. And obviously, using the brand name medications is the way to go if people are able to do that with insurance coverage. But and they are chemically a little bit different. But my experience is if you're doing the other things you should be doing, which in a nutshell is low carb, high protein, intermittent fasting, and strength training, because strength training helps reduce insulin resistance as well, that they're both effective.
Agreed on the strength training. That's
Yeah.
something I'm always preaching about. Such a believer in what it can do for us, even longevity wise. Now, looking at individuals who might not be good candidates, are there individuals who shouldn't do this? Or the other thing I've heard is, are there people who it just doesn't work for? Like they just don't get the benefit.
Yeah, the answer is yes. There are some absolute what are called contraindications, people that can't be on the medicine if they have certain types of cancer that run in their family, thyroid cancer or other types of cancer. If you have a history of significant gastrointestinal problems like liver disease or pancreatitis, then the medication should be avoided as well. So there is a screening process to this to make sure it's safe for that individual. And then in terms of effectiveness, I would say most people get hunger suppression with this, but I will tell you also that I've had patients that have had difficulty making weight loss progress on even moderate doses of medicine. So not everybody responds the same. And so that's the reason that if you're considering this for both that reason and for the reason of having the ultimate goal of getting off the medicine without weight regain, again, you need to be emphasizing the things that we talked about. And to follow up on your comment on strength training, on these medicines, you are not only losing fat, you're at risk for losing muscle mass as well, especially important in perimenopausal and postmenopausal women, because the amount of muscle mass you have, as you well know, Carol, relates to your risk for osteoporosis. And so you got to make sure you're maintaining your muscle mass if you're choosing to use one of these medications, even in limited amounts. And that's why we emphasize that. So really, you get a double benefit. You're maintaining your muscle mass in the face of these medications. And as you increase your muscle mass, because your muscles are soaking up more insulin and more blood glucose, you're reducing, insulin resistance risks down the road as well.
Now, what about individuals like myself? I don't have weight to lose. But I've heard that microdosing GLP-1s could be effective long-term for longevity. Do you have thoughts on that? That's been really circulating out there in the health space right now.
Well, there's no question that the pharmaceutical companies are looking at multiple indications for these medications. And already, new indications have been approved by the FDA for people. They're all in the context of somebody that's overweight in this case, but let's talk about that and then we'll talk about other potential indications. Basically reversing fatty liver disease, reversing the risk of a second cardiac event in somebody that already has a heart condition, reducing sleep apnea, which just makes sense. If you're going to lose weight, you're going to decrease your risk of sleep apnea. So there are all those considerations. Now there are other studies that are beginning to look at, is there an impact on dementia? Is there an impact on long-term cardiovascular health in people that don't have a previous cardiac event? The one area that I'm impressed with based on my current patient population is how these medications suppress alcohol use.
Yes.
I think that these medicines are going to be the next approved medication for alcohol use disorder. And I've had a history in a past life. I worked with alcoholic patients, and a lot of my patients now, some of them drank a lot more than they wanted to drink, and it suppressed their use. Some patients that are put on this medication quit drinking altogether. So I think there's no question that there's going to be other indications. In terms of overall longevity, that's hard for me to say. We're always looking for the fountain of youth. But when people think of longevity, I think you need to think of not only how long you live, but how healthy you're going to be during that period of time. And that comes back to the lifestyle issues that we've been.
I love that you hit on the use for alcohol disorder, really an important thing to think about going forward, because I think there's a lot of people that are in kind of a gray area where they're like, I don't consider myself to have a problem, but I'm doing this more than I want to do it. And then, of
Right.
course, it is an addictive substance and people begin to crave it. I went alcohol free completely in December and
Good.
haven't looked back, feel fantastic.
Good.
It's just made such a difference in everything from my skin to my sleep to my energy to my what I thought was brain fog. And
Yeah.
again, it had just become this habit of long hard day, stressful. Oh, I deserve a glass of wine, that kind of
Yeah.
thing. So I
Yeah.
really love the idea of it helping people in that respect.
Yeah, yeah, and again, I think it's going to be approved eventually. Again, I'm just predicting this isn't a current indication, but I think it's going to be approved for alcohol use disorder. Patient now, would need to be overweight generally to be prescribed the medication. A lot of people that use alcohol unless they're big beer drinkers, quite honestly, are often not overweight because they use that as an alternative calorie source. But again, I think there's a lot of good things on the horizon in that arena.
I do too. Now, I've also heard reduction in inflammation. Is that true? And that might be part of that longevity piece that people are discussing.
Yeah, I mean, we're all striving for less inflammation. That comes back to the seed oil issue that we just have been talking about. I'll be honest with you, I don't have any specific issue on it decreasing inflammation, but again, if you're decreasing body fat stores, you're
Yes,
decreasing inflammation, so that's going to contribute to that as well. And I mean, quite honestly, if you're losing weight and you've got a lot of pressure, for example, across your knees and your hips, and you're relieving some of that, then that's going to reduce inflammation as well.
I agree. Now, shifting a little bit over back to diet, intermittent fasting. I believe in intermittent fasting. I don't think it's right for everyone in every situation. Once again, just looking at somebody's goals, where they're at, what is the population we're working with, very important. But I do think it's beneficial for a certain individuals. I know you're a proponent of it, but how long is long enough to fast? Because this is back and forth, the debates. How long is too long where you would be losing muscle mass? How do we do this safely?
So the answer, you're going to hate this response, but the answer is it depends.
Oh, I know.
So, for me, when patients come in to see me, I kind of assess where they are. If a 10-hour fast is a huge deal for them and they haven't necessarily done it, then we start there, or even a little bit less than that. But on a day in, day out basis, I usually try to get my patients to 14 to 16 hours a day of fasting, doing that most days of the week. If you're having a special occasion, going out for a special dinner with family that's later, or, breakfast on the weekends with whatever, going to a wedding, then it doesn't have to be every day. But what I generally look for from my patients is 14 to 16 hours overnight. Now, I don't push it after that. I have had patients that have gone to OMAD, and are really just eating in a 2-hour window every day. I'll do that not infrequently myself. I usually don't push people beyond that. I mean, I personally believe if, you want to fast for a day and wait until the following evening for dinner up to 36 hours, then that can be a reasonable thing. I usually don't push people beyond that. In fact, even if they go 36 hours, that's really their decision to do that. Some people feel good, you start getting a little bit of ketosis, and some people really just feel physically better when they get into that range. But I don't push longer fasts. I know it's not uncommon for people to want to do 3-day fasts or longer. But I generally try and, again, keep it simple, 14, 16 hours or OMAD. What do you do?
I have the same philosophy. Personally, I go anywhere from I've settled in at that 12 to 14-hour range for me, and again, it's because of my activity level generally. Now that I'm recuperating, I can go a little bit longer. But working with clients, I never push past the 16-hour window. I usually 14 to 16 is kind of that sweet spot because I'm so concerned about them getting that protein intake in, and then also being able to build muscle mass. And then I do have concerns. Perimenopause is such a stressful period of time for women. And sometimes women come into me, they're not sleeping, low energy, very high stress. So obviously, I'm going to dial that back. And so I have an it depends philosophy as well.
Yeah. I think you can get the
Now,
benefit with a 14 or 16-hour fast.
yes, for most people, I agree. Now, my husband, it's different for him. He can go all day and do that one meal, no problem. No loss of muscle. He's not cranky. I try to do it and it doesn't work so well for me.
Yeah. Yeah. I think it can be individualized, but I think if you're at 14 or 16 hours a day, you're getting the benefits.
Agreed. Yes. Now, what about caloric intake? That's another hot topic in the space. Some people are saying it's hormones. Other people are saying it's calories. I'm kind of the truth sort of lies in between
Yeah.
somewhere. What are your thoughts on this?
Again, I'm going to go back to a simplistic model. I have my patients keep the carbs low and the protein high and avoid the bad fats. And quite honestly, I don't even have patients count calories early on. Now, if they get stalled and they get in trouble, in terms of not making progress, then we begin to look at that. But I would say in 80% of my patients, we never look at that. Because if they're keeping their carbs low and their protein high, then generally calories are not an issue. I'm not going to tell you it never happens. Generally when we talk about controlling calories, the first look at that is a little bit of portion control, but not necessarily the calories themselves. So, a little bit different approach. I tell my patients, don't worry about calories, don't worry about fat that much. And the other thing that's a little bit different from the normal advice they might get from a physician is don't worry about getting on the treadmill or the elliptical that much, but get in the weight room. So, I have a tendency not to emphasize calories. And one reason for that is for weight loss, there's basically two schools of thought. It's low carb, lower blood glucose, so you can decrease that visceral fat deposition and then reverse that, or it's calories in, calories out. And I don't think limiting your calories in for a lifetime is doable. I think it's very unlikely to be successful. Whereas low carb, especially with the use of a CGM, if you see the data, low carb can become a lifestyle where you don't think about foods you used to think about. You don't think about donuts or pizza unless you scrape off the top of the pizza and maybe have a little bit of that. I mean, or waffles or pancakes. I mean, I just don't even think, and it doesn't bother me not to think about it anymore. It just becomes a lifestyle, and you feel better. And then there are those foods that are damaging that you don't even have to worry about.
Do you think it's a matter of people? I talk about kind of clearing the signals to your brain, for lack of a better terminology, when it comes to these foods because they're addictive.
Yeah,
And do you feel like, is it like ripping the Band-Aid off, like just get rid of those foods? Or can people gradually cut back? I know for me, the moderation thing doesn't work so well. That's why I did alcohol free. It just doesn't work for me. It's
yeah,
just, nope, get rid of it. It's gone.
yeah. And I'll tell you, I'm going to come back to the CGMs. They're a mechanism to do that because once you see, I have patients, they come in and they don't think they have a blood sugar problem and they're spiking to 210, close to the diabetic range. They self-correct. You don't have to worry about, again, this incremental change over a period of time. It's just like people understand that's what's been happening to me. I want to fix that. And so, yeah, I have a tendency to think, I mean, it's a matter of perspective. I don't think 50 grams or less a day is extreme once you get used to doing it. Some people might have more problems, but again, I think it's just easier to go to those lower levels and incorporate it into your lifestyle, and you don't go back. I mean, it's really rare that somebody that has gone low carb, has complete disregard for their carb intake going forward. Okay, they might have problems, they might have periodic issues going through periods of stress or whatever where they're eating more carbs than they want, but by and large, people at least know what the issues are and then stay grounded in that approach. And again, I think it's a lifestyle change. Calories in, calories out isn't a lifestyle change. It's not sustainable, but a low carb approach with, the other things we talked about, intermittent fasting and strength training, is a lifestyle change. And quite honestly, in the big scheme of things to improve your health, not as hard as other approaches. I think just, doing those things can be sustainable for a lifetime and can lead to good health and longevity for a lifetime.
Sustainable is the key word because people can lose weight. I see it all the time. But are they going to keep that off? Or are they going to gain it back and then some and have a real problem after that? So that sustainability is so very important.
Right. Absolutely.
Now, when we talk about individuals that, okay, let's say you get somebody in, and I don't know if this has happened to you, and we always have those outliers that just don't respond quite, I guess textbook you could say, as their body should. What about that weight loss resistance? Do you get individuals in that you find have weight loss resistance, or has it been caused? Perhaps they've downregulated their metabolism by eating
Right.
ultra low
Right.
calorie for a long period?
Yeah. So it's a process, and there can be a transition when that occurs. So there are people that can have trouble getting started. I got to make certain that people are approaching this the way they should, because I have a lot of people say that, oh, I'm low carb, I'm under 50, but they aren't counting their carbs. And it turns out when I get them to count their carbs, it's not 50, it's 100 to 125. So that is one difference. And then the other thing is, physiological systems are not necessarily a straight line from point A to point B. You're going to have periods of progress, and then you're going to have plateaus before you progress again. So I think it's important for people to understand that, even if you're doing the same things and you're not progressing the way you have in the past, you may be just going through a period of a plateau. And we'll tweak a few things here and tweak a few things there. But I think the processes and really the axioms of this approach, are true. And so you just got to believe, and you have to stay with the program. And then, that's when I have had people say they want to dip their toe in the water, the GLP-1s. We'll do that on an interim basis for somebody that's frustrated. But again, it's in the context of let's have this long-term vision, not, quite honestly, not just for the next year or two while you're working with me, but for the rest of your life.
I did bodybuilding shows for many, many years and it was a good thing. It taught me a lot about my body, a lot about macronutrients and food and diet and exercise, lifting, all very good things. But boy, when you got down to the final 6 to 8 weeks, depending on how far you had to go, it
Yeah.
was so restrictive. And then what I think people don't understand is then your hunger hormones begin to dysregulate. And I remember trying to reverse out of that and how hard that was. And I imagine it's the same individuals who are over dieting or yo-yo dieting are experiencing that same dysregulation.
Yeah, yeah, and that's why I don't like to go there in terms of that calorie restriction. Again, a stable amount of carbs, stable amount of protein is sustainable long term. So you can avoid this up and down kind of approach as you really just embrace a new lifestyle.
Now, you've been doing this a long time,
Yeah,
and I'm sure you have seen, 30 years over these decades, like there's these changes
yeah.
occurring. What do you think is coming up on the horizon?
Well, so my hope is what is coming up on the horizon is that we're going to have a movement away from processed foods because this is really what has caused the problem over the course of the last 50 years. So, I came to this out of the emergency department, seeing, maybe the majority of the patients we see in the emergency department every day be there because of preventable issues, high blood sugar that leads to obesity, diabetic complications, heart attacks and strokes, kidney failure, peripheral vascular disease. A lot of it unnecessary, and I think caused by the epidemics in diabetes and obesity, caused by what we were told to do related to the food pyramid and giving an opening for the food processors to make inexpensive food that are loaded with carbs, sugars, and seed oils. So what I hope is coming, and this is why I like the MAHA movement thing, Make America Healthy Again, is that we're getting back really to the way we ate for generations before we were told that carbs should be the foundation of our diet and processed food was the standard. So my hope is we're going to gravitate away from that, and as we do that, people will get healthier. They'll lose weight. They'll have less inflammation, but it's going to take a bit of fortitude. And in the United States, we believe people should have a choice to a great degree to do what they want to do, and so you can't have policies that are overly restrictive. But by the same token, my hope is we're entering a new era of education where people understand the damage that these foods have done and that they are empowered themselves to go ahead and reverse that process.
I sure hope so, because it does scare me to see the younger generations come up and have so many health problems. And kids, I see kids that are very overweight, they're already struggling, and what lays ahead of them is a hard road.
Right, right. And I've had young patients, teenagers working with their parents and their pediatricians, and they're very data driven. And so the CGMs can be a
I
great
bet.
tool in those young data astute individuals. And when you see a late teen that's already got a high insulin level and heading toward pre-diabetes, from my standpoint, it can be very, very satisfying to see that change. They realize that they don't have to be like maybe mom or grandpa was in terms of their health issues and diabetes and that they have the power to go ahead and change that. My hope is that what's on the horizon is just people progressively educating themselves. The whole flow is in the other direction. We're swimming upstream because the flow is processed food, easy to eat foods, a medical system really that is more focused on disease management, writing prescriptions for medications rather than prevention or reversal of disease. So I hope we're entering an era where just a progressively larger number of people are aware that these are issues and that they have the power to determine their outcome.
Yes, I think the wearables are a big help. I know I'm personally into the data. I have my watch, I have my Oura ring. When I wore the
Yeah,
CGM, I really got into the data. But
yeah.
but it helps. I mean, my sleep improved when I began wearing the Oura ring because then I had awareness, and it's like, oh, maybe I need to turn the electronics off or not eat as late. You just start to wake up to these things and naturally make the choices. So I'm all for that. Dr. Kolodzik, thank you so much for being on the show today. As we wrap up, was there anything I didn't ask you that you'd like the listeners to know?
No, other than I think the last point that we made is that you have the power, basically. You have the power to control, your health. You need to, not be influenced by a lot of the systems that are in place that we've talked about, the medical system, pharmaceutical industry, the food processing industry, other than you have the opportunity and can empower yourself. So I'll make a plug for the use of CGMs. I'm licensed in Ohio, Indiana, Florida, and Arizona. I can accept people in those states as patients. For the other states, I have a website which is CGM-Doctor, spelled out DOCTOR, and you can get CGMs at the lowest cost available on the market, and you can follow your data. Again, we have some health coaching available as well. And then I'm going to plug the book, The Continuous Glucose Monitor Revolution for Non-Diabetics. So this book now is a couple years old. It's now the best-selling book on Amazon, but it teaches people how to use a continuous glucose monitor to sometimes change their life and redirect the course of your future health. So, it's available for $10 on Amazon, and I'm just passionate about this and feel, I'm biased enough to think that the more people that read the book, the more lives we can change. And so I would encourage people to maybe have a look at that as well.
The book is excellent, so I encourage you to pick that up and to follow Dr. Kolodzik. You're on TikTok, is that right, and Instagram? Are those the main spots that we can
Yeah,
keep up with
yeah.
you?
Mostly TikTok, Instagram, and then I have a YouTube channel as well. And then, I have a website for the medical practice. You can just Google me, and then the website for CGMs, where we provide the support to patients that, want to, again, begin to explore the value of a CGM and helping them improve their health.
Well, I'll make sure all that is in the show notes. And thank you again. We really appreciated the work you're doing, the education you're providing people. Knowledge, I do believe, is, I don't like to say power, that's such a cliche, but having that knowledge and then what we do with that knowledge is power. So thank you so much.
All right. Thank you again for having me.
And to our listeners, wherever you are in the world, we wish you every blessing. Bye for now.